have a three type of cornu: anterior, posterior, and lateral. But lateral have only C8 to all C to L3, and each spinal nerve have two types of radix: radix anterior and radix posterior. Who can say me? Radix posterior for it's what? Motor, sensitive,
Sensitive.
Radix posterior all time is sensitive. We have ganglion spinale where located pseudo-unipolar cells. And radix anterior,
Motor.
only motor?
Yeah.
Motor mixed.
Okay, mixed types.
It motor of cervical segments because we not have vegetative fibers. But if we say about thoracic cranial nerves, we have it's mixed because we take vegetative nerves fibers too. So posterior radix all time only sensitive, contain pseudo-unipolar cells. It's first neuron of reflex arch, and radix anterior, no red, orange on this picture. It's a motor, but from segments C8 to L3 have a vegetative fiber, so it's mixed. Understand? Because some students on the exam say that posterior sensitive, anterior motor. It's mistake. Posterior sensitive, anterior mixed. Understand?
Yeah.
This moment. And when we were in the spinal, where in the in the vertebrae, who remember where passes the cranial nerve?
Intervertebral foramen,
intervertebralia. Yes, I can take the preparate to remember you. Can please wait 1 minute. Vertebra have a two incisura, superior, inferior, and when we connecting all vertebra, we can see foramen intervertebralia. In this place, cranial, it's cranial nerve. Cranial nerve is exit. Understand? Foramen intervertebralia on two sides. This, yes. It's looking like. It's looking like this. Spinal nerves.
Yeah.
When we exit in foramen intervertebralia, yes, two radix making one truncus nervi spinalis. They are connecting and making one truncus one. Two radix exit in foramen intervertebralia and making one truncus nervi spinalis. We have 31 cranial nerves.
31 pair.
And when cranial nerve is exit, it's divided to two branch, anterior and posterior. And posterior dividing to two branch, more little branch, lateral and medial. You should know what innervate the posterior branch. Так. The posterior branch innervate all our body from the head to the foot. Guys, innervate skin and muscles. Remember, all cranial nerve is mixed. Innervate skin, innervate muscles, and sometimes innervate smooth muscles and glands if we say about segments C8 to L3. And if we say about posterior branch in the, innervates the back sides of head, neck, spine and legs, all body, posterior part, dorsal part. 1 second. On this picture you can see, come to me. You can see the segments C2, C3, C5, the thoracic segments, the sacral, and how they innervate all our body. posterior branch innervate posterior surface of our body, skin and muscles, because our cranial nerve is mixed. It's about posterior branch. And if we say about anterior branch, we innervate anterior part of our body, begin with the head and ending the foot. And you can see that thoracic cranial nerve, how say, segments, save the segments. If we say about cranial, sacral, lumbar, it's have not segment innervation, and thoracic innervate the segments. Innervate skin and muscle of ventral part of our body, from our head to foot. Understand this? And revise. Radix posterior, radix anterior. They passes from the foramen intervertebrale and making one truncus nervi spinalis. And this trunk have two ramus. Ramus posterior and ramus anterior. And ramus posterior have a two branch, lateral and medial. Ramus posterior innervate skin and muscle of dorsal part of our body. Ramus anterior innervate skin and muscles, ventral part, anterior part, yes, of our body. And we have a ramus meninges. Ramus meninges passes from the foramen intervertebrale back, go to the spinal cord, and innervate our vessels of meninges. Muscles of meninges, yes. And we have ramus communis albi and ramus communis grisae. When we discuss the autonomic nervous system, we have the ramus communis albi connecting spinal nerve with the truncus sympathicus, and rami communi grisae connecting truncus sympathicus with the spinal cord. But only C8 to L3. If, for example, we take a cranial nerve number 2, cervical 2, we can see only motor and sensitive. We not can see autonomic nervous system. Understand? So, if common, if teacher asks you what ramus have each cranial nerve, you say have ramus anterior, ramus posterior, ramus meningeus, and ramus that go to the autonomic nervous system, ramus communis albi and ramus communis grisae. You can call it together in Moodle, writing ramus communis. Yes, ramus communis. Ramus communis. Communicantus. Ramus communicantus. Ramus anterior, ramus posterior, ramus meninges, and ramus communicantes. And ramus communicantes have two types, albi and grisae. Albi go from spinal nerve to truncus sympathicus, grisae going back to truncus sympathicus to the spinal ganglion, or to the spinal nerve. Understand what fibers have the spinal nerve? And spinal nerve, only ramus anterior of all spinal nerve can make the plexus. Plexus. Plexus, this is a set of fibers. Plexus. And today we discuss two plexus. Plexus cervicalis and plexus brachialis. Plexus cervicalis, cervicalis and plexus brachialis. But before discuss this, we discuss what innervate and ramus posterior of all spinal nerve sometimes have names. If we say about a cranial segments, cervical, where the cervical segment number 1, first cranial segment, have nervus subaccipitalis. Nervus subaccipitalis. And this nerve innervate skin. Innervate the muscles. Muscles of occipital group. I can show you these muscles. Or maybe I confuse. Muscles. Subaccipitalis.
Oblique muscles.
Yes, subaccipitalis innervate the muscles. I show you these muscles. And when we discuss cranial nerves, guys, we revise the muscles. Who remember muscles? Maybe.
मतलब trapezius, rhomboid, rectus.
Can please I go and show what muscles innervate nervus suboccipitalis. The muscles of occipital region. These muscles. Musculus obliquus inferior, number 5. Nucleus. Nerve. Musculus obliquus superior, number 4. Musculus rectus posterior minor and musculus rectus posterior major. I remember these muscles. 2 oblique muscles and 2 rectus muscles. These 4 muscles innervate nervus suboccipitalis or first cervical vertebra, ramus posterior. Understand? Ramus posterior or first cervical vertebra give a nervus suboccipitalis, and this nerve innervate 4 muscles of occipital region. 2 oblique muscles, musculus obliquus inferior superior, and 2 rectus muscles, musculus rectus posterior lateral and medial. Understand? The cranial nerve, cervical. I confused cranial. Cervical. The cervical nerve number 2, it's a sensitive because innervate the skin. Innervate the skin and called nervus occipitalis major and called nervus occipitalis major and innervate the skin of occipital region. Nervus occipitalis major. Sensitive. First, be motor, innervate the muscles, nervus suboccipitalis. Second, cervical vertebra, posterior. Now we talk only about posterior surface, posterior ramus. Second, called nervus occipitalis major, and this nerve innervate the skin of occipital region. Understand? And third, nervus occipitalis tertius. This nerve innervate skin too, occipital region, but more lateral. Understand? It's about ramus posterior of cervical vertebra. And how we say the anterior ramus making a plexus. And today we discuss plexus cervicalis. Plexus cervicalis, it's made anterior branches, cervical vertebra number 1, 2, 3, and 4. C1 to C4. This cranial nerve give anterior branches and they making plexus cervicalis. And this plexus cervicalis have 3 types of nerves, 3 types of branch: skin, motor, and mixed. Skin innervate skin of anterior surface, motor muscles, mixed have 2 types: motor and sensitive. At the beginning, about skin, I show you on this picture. We have nervus occipitalis minor. This is nervus occipitalis minor. Innervate the skin of occipital region. Nervus occipitalis major is this. Nervus occipitalis minor is this. Nervus occipitalis minor. We have a nervus auricularis magnus. This. Nervus auricularis magnus. Innervate the skin of auricula and meatus acousticus externus. Nervus auricularis magnus. We have nervus transversus colli. This nervus transversus colli. This nerve go to the platysma and innervate the skin region, this part of platysma. And who remember what cranial nerve innervate platysma? Platysma. What cranial nerve? Facial nerve. Nervus facialis, nerve number 7. innervate the musculus platysma. So nervus transversus colli anastomosis with nervus facialis and making a loop. Loop in English, ansa in Latin. Ansa cervicalis superficialis. Ansa cervicalis superficialis. And innervate platysma. Understand? But platysma muscle innervate nerve number 7, skin region innervate a cranial innervate the plexus cervicalis, anterior branch. Understand? Plexus making only anterior branches. And anterior branches of cervical vertebra 1, 2, 3, 4, they are connecting, making a set of fibers, and then innervate skin and muscles. Skin, revise again, nervus accipitalis minor, nervus auricularis magnus, nervus transversus colli, and nervus supraclavicularis. Nervus supraclavicularis. Innervate the region of musculus pectoralis major, and who can look in second muscle? What is second muscle?
In the skin.
Skin, yes.
Supraclavicular nerve.
Yes. What innervates supraclavicular nerve?
Pectoralis
Major
nerve.
Pectoralis major.
And deltoidus, yes. Innervate skin, not muscle. Innervate the skin that located under the muscle. Musculus pectoralis major and musculus deltoideus. Nervus supraclavicularis. 4 skin nerves. Revise. Nervus transversus colli, anastomosis with cranial nerve number 7, and making ansa cervicalis superficialis. Nervus auricularis magnus, innervate the skin of auricula and meatus acousticus externus. Nervus occipitalis minor, innervate the skin of occipital region, lateral part, and nervus supraclavicularis, innervate the skin above the nervus pectoralis major and the deltoideus muscle. Understand skin? Not say on the exam innervate the muscles. Innervate the skin above the muscles. It's about the skin. And we have, it's about skin part, and we have a motor part that innervate the muscles. Who remember muscles of neck? Who remember muscles of neck? What part? What divides superficial muscles? What superficial muscles? Platysma and sternocleidomastoideus. Yes. Who innervate platysma and sternocleidomastoideus? What cranial? Platysma facial, sternocleidomastoideus.
9.
Accessorius. Accessorius innervate.
11.
It's about superficial layer. Middle layer. What muscles of middle layer? Middle layer, who remember? Located above and below os hyoideus. It's what muscle? Musculus digastricus, musculus stylohyoidum, milihyoidum, and geniohyoidum. 4 muscles: geniohyoidum, milihyoidum, stylohyoidum, and digastricus. Above the oshyoidum and below omohyoidum, sternothyroidum, and thyrohyoidum. Middle part. And deep, free. Scaleni muscles, musculus scaleni anterior, medial, and posterior. What is this muscle? Musculus longus colli, musculus capitis, musculus longus colli, and musculus rectus anterior and musculus rectus lateralis. It's deep muscles. And the motor part of cervical plexus innervate deep muscles. All these 7 muscles. And on the next lesson, if I or Inga ask you what innervate plexus cervicalis, you say it's innervate the skin and show this for nerve. Revise or you remember? Remember this? Revise. Nervus accipitalis minor innervate the skin of occipital. Nervus transversus colli anastomosis with nervus facialis. Nervus auricularis magnus innervate the auricula and meatus acousticus externus skin. And nervus supraclavicularis innervate skin above musculus pectoralis major and the deltoid muscle. Understand skin branches? 4. It's about skin. And motor innervate a 7 deep neck muscle. And you name and show. At the next lesson you show me these muscles. Revise musculus scaleni anterior, media and posterior, musculus longissimus capitis and colli, and musculus rectus anterior and lateral. Revise at home muscles, because before the exam you haven't the time to discuss this again. So teach muscles again now. Understand? Muscles part, cervical plexus, innervate all these 7 deep muscles. Understand? And what else innervate? If we say about motor plexus, I remember nervus hypoglossus making ansa cervicalis profunda. I show you in the book. Ansa cervicalis superficial. We anastomose it with facial nerve. Nerve number 12, nervus hypoglossus, have a how it's called, a ramus anterior, and this ramus anastomosed with plexus cervicalis and making ansa cervicalis profunda. Superficial we show on this picture, profunda I show you in this, and then I show you on the body too. This is ansa cervicalis profunda. Ansa cervicalis profunda is made by nervus hypoglossus and plexus cervicalis. They are connecting and making a loop. I all see the loop. Who remember what innervate this loop? Muscles located below os hyoidum. Omohyoidum, sternohyoidum, sternothyroidum, and thyrohyoidum. So, what innervate plexus cervicalis? Muscles located below the os hyoidum with the nervus hypoglossus. They are connecting and making a loop. Loop in English. Ansa in Latin. Ansa cervicalis profunda. And this loop, this ansa, innervate muscles below the os hyoidum. And then you go to the market and show me or Inga. Inga asked this, I know about this. These muscles, so at home, revise muscles of neck, all superficial, deep and middle. And revise muscles of, now we discuss the bronchial, bronchial plexus, yes. And in this topic we discuss pectoral muscles and back muscles. So revise all. Muscles, all muscles. Так, it's about a motor part of cervical plexus. Revise. What innervate cervical plexus? Give skin and motor and mixed. Mixed now I explain you. Skin we show on this picture. Innervate only skin, and muscle innervate deep muscle of the neck, and with the nervus hypoglossus making ansa cervicalis profunda. All understand this moment or not understand? Nervus hypoglossus give ramus and nervus plexus cervicalis give ramus. They are connecting and making a loop. This is hypoglossus, this is plexus cervicalis. They are connecting and making a loop, and this loop, this ansa, innervate muscles located below the os hyoidum. Omohyoidus, sternohyoidus, sternothyroidus, and thyrohyoidus. Understand? It's about motor. And we have one mixed nerve, nervus phrenicus. Nervus phrenicus. This nerve located between musculus scaleni anterior and medial, then going down to the thoracic cavity, located in the mediastinum anterior, and then going to the diaphragm. But to the diaphragm going only motor fibers. Why nervus phrenicus is mixed? Because he have motor fibers and sensitive. Motor going to the diaphragm and innervate it, because diaphragm is a muscle. I remember what is the diaphragm? Separate thoracic and abdominal cavity. Yes. Motor fibers going to the diaphragm and sensitive fibers innervate pericard of heart and pleura of the lungs. Pleura. Yes. When nervus phrenicus going down, it gives a sensitive ramus to the pericard and to the pleura, and motor going to the diaphragm and innervate this. But this is not all. When nervus phrenicus innervate the diaphragm, some fibers going to the liver and innervate the liver. So we have how doctors can understand what problem happened with the liver of person. For example, person say that he have a pain in the abdomen. Our liver not have pain, but our liver have a capsules. And when liver for disease making a big, this swallow, this capsule it's how say растягивается, expand. Nervus phrenicus gives signal to the musculus sternocleidomastoideus, and when doctor touch musculus sternocleidomastoideus of person, he feel pain in liver. Nervus phrenicus gives signal and he feel the pain. Yes. No, not touch, how say? It's path, yes, pain. In normal we not feel something, but if you pin and feel the tap, бить, ударить по-русски, ударить. Поэтому, on this muscle, in normal you not feel something, but if person have problem with liver, he feel the pain. Understand why? Because nervus phrenicus go to the liver. Understand? Nervus phrenicus mixed. Understand why mixed? Sensitive fibers go to the pericard and pleura, and motor go to the diaphragm. Understand cervical plexus? You should know what cervical cervical nerves. Cervical nerves number 1, 2, 3, and 4 making a plexus cervicalis. Only anterior fibers. I understand why. Ramus posterior more thin and small. They innervate the dorsal part. Ramus anterior, maybe you understand that we have more muscles on the anterior part. So ramus anterior it's more big. And this ramus can making a plexus. And today we discuss the plexus cervicalis. Plexus cervicalis is made by cervical nerve 1, 2, 3, 4. And this cervical plexus have 3 types: skin, muscle, mixed nervus phrenicus, muscles, the deep muscles of neck and ansa cervicalis profunda with the nervus hypoglossus, innervate muscles of neck below the osteoideum, and skin we show in this picture. 4 innervate skin, only skin. Understand the cervical plexus? Так. And you can make a photo on this picture. In this picture, writing all muscles that you should know.
फोटो